So you're interested in getting lip fillers. That is so exciting. So here's your ultimate guide to everything you need to know before getting lip fillers. So first things first, you need to understand your aesthetic goal. So when you're looking at your own lips, how much bigger do you want to go? Are you looking for more structure? Are you looking for more shape? Are you looking for more volume? So looking online at some before and afters is a good way of understanding what can be achieved with fillers. Once you've understood what you want, here are a few things that you should keep in mind. When it comes to lip filler, if you want to go to a drastically bigger lip, that can take some time and a few sessions of building up. So typically what I recommend is to come in every month or so for about 1 to 3 or 4 syringes, depending on how many you want to have, and then you can maintain that lip shape. The more you do lip filler, the longer it will last. So if you just start off with 1 syringe and then you kind of just let it wear off on its own, it's not gonna last as long as if you had built up a couple syringes and you have some lip filler already on deck. So one thing to just consider is that 1 syringe is not that drastic of a change. And most people who you're like, oh my God, yeah, that person has lip filler, they've probably built it up quite a bit before they've reached that desired goal. So it's important to understand that for first timers, I know a lot of first timers come in and they're like, oh, can I just do a half syringe? I don't want to do anything too crazy. I just want to try it out to start. And my answer is always, no, because half a syringe is really, really minimal and you'll be disappointed in the end. It's better off you do a full syringe, get a feel for it. You like it, great. You want to add on, great. But to give everything a fair chance, it's better to do a full syringe. I only ever recommend starting with a half syringe if the lips are literally paper thin and I know that a full syringe wouldn't even fit. Another thing when it comes to lip fillers is that there are many different kinds of lip fillers, many different kinds of hyaluronic acid fillers that are going to be suitable for your lip. So it's important to just discuss with your provider what your end goal is. That way they can use the appropriate filler for your lip. So once you've booked your appointment, one thing to consider is, are you healthy? Are you feeling up to the appointment? Meaning, do you have any cold symptoms? Are you feeling under the weather? If that's the case, I would recommend postponing your appointment. The other thing is make sure that you haven't had any vaccines in the last 2 weeks prior to the appointment or any kind of dental work. And that's just because we don't want to inject a foreign filler into the body while the body is on the defense. So it's important to make sure that you had nothing major going on. You're not on any antibiotics, you're not taking any immunosuppressants, and that you're going into your appointment fairly healthy so that your body can accept the filler and you get the best desired outcome. And that will also help prevent any type of infection or reaction to the filler. Okay, so on the day of your appointment, you're probably going to be getting some type of numbing cream or dental block or laughing gas to help with the pain. Typically, I find most people use numbing cream and they find that's good enough. We have a very strong numbing cream and people typically find it to be really nice and numbing. I personally don't care for the dental block too much just because I feel like it's a bit too extreme and the dental block's gonna last a few hours after your appointment. And the good thing about injectables is that minimal downtime. So I want you to be able to leave, go eat, go have lunch or whatever. So I'm not too big of a fan of the dental block, especially since the injections only last a couple minutes. So I find that the topical numbing works best. The filler in itself does contain lidocaine, which is a numbing agent, so that helps as well. The more you're being injected, the easier it is to tolerate. And then once your injector has gone through everything, all your paperwork, all your consent forms, your health history, then they're gonna go ahead and inject you, probably take some before photos. And then the injections themselves don't last very long. It takes about 5 to 10 minutes tops. They may massage afterwards. And then the most important thing for you after the procedure is just to keep the area clean. Expect some redness, some swelling, some potential bruising. Bruising is usually the worst the night of and the next day. And then on day 3, 4, it starts to look a little bit better. And my recommendation is just to ice. Ice is the best thing you can do. All the other stuff like arnica and all those other things I typically don't recommend. I just find that icing is the best solution, and typically just some time. For a first timer getting lip fillers, it can be a little bit scary to see all that swelling and you're like, oh, maybe I did too much. And there's a lot of emotion that people typically go through. But just trust the process, give it a week, everything will settle and they're going to look beautiful. The other thing to know about swelling is that swelling can be uneven. You may swell on one side more than the other, and then people tend to believe that the filler is uneven, but that's not typically the case. Typically it's just swelling. So again, the swelling can last up to 2 weeks. So just give it some time and your lips are going to look fabulous. Bruising can last longer than the swelling. Typically bruising can last up to 2 weeks for sure. Okay, so here's my pros and cons list. Let's start with the pros. The pros is that it's quick and easy. It lasts a fairly long time. People are typically really happy with the results. It has a really high satisfaction rate. There's nothing else like it on the market to give you those plump lips. Another pro is that fillers have come a long way. We've moved away from the permanent and semi-permanent fillers, and now we use more of the temporary hyaluronic acid fillers, which are really safe. And above all else, they're dissolvable. So worst case scenario, if you absolutely hate the filler, we have an enzyme we use that can be injected into the filler and it completely dissolves the filler, and that makes it that much more safe. And then the cons would be risk of infection, risk of occlusion. Occlusion is basically when filler is blocked with a blood vessel, so you should always look out for any signs that you are not expecting to see, any tingling, any extreme pain. Extreme pain with fillers is not normal. Any excessive swelling or discoloration. Then again, we have that enzyme to dissolve filler. So if that were the case, it's typically reversible. As long as you catch the signs, it's pretty much okay. Another possible con, just not having your expectations met. So filler, it can be pricey for some, and when you're told that you have to build up your lip with a few syringes, people typically can be disappointed with that, or they expect one syringe to give them the change that they want. So just setting your expectation and knowing what to expect one syringe to look like, especially the 2 weeks after they've settled. A lot of before and afters you see online are pictures that are taken right after the injections. And the truth is that right after the injections, the swelling has already started to occur. And when they settle much smaller. So it's important to keep that in mind. If you can find some after photos that are after the 2 week mark, then that would be ideal. Okay, and just a little bonus here, I'm gonna give you guys my healthy tips to getting lip filler so that you always end up with great results. Number 1 would be to make sure that your lips are hydrated before you go in. Make sure your lips are healthy and they're not cracked or really dry. Number 2 is I would recommend not doing more than one syringe in one sitting. That gives your lip tissue enough time to expand and kind of settle with the filler. Number 3 would be, if you want to add more filler, to wait at least 2 weeks before you get your lips refilled. Number 4 would be, don't go overboard. To prevent any type of migration, I recommend not having more than 4 or 5 mLs or syringes of filler in your lip at any given time, just because there's only so much space in your lip, so you don't want to overdo it. And then lastly would be, if your lips need dissolving because of a bump or lump, or they just don't look good anymore, or they're overfilled, or they're migraining for whatever reason, just get that dissolved and start again. So don't be afraid to dissolve your lips if that's what you need to do. A lot of the time some people get carried away or whatever and their lips just end up not looking the greatest. So don't be afraid to dissolve if you have to. Okay, so this was my little guide on things to consider and know before getting lip fillers. If you have any questions, leave them down in the comments, and be sure to ask your provider any questions you may have. And I will see you guys in the next video. Bye.